So we aspired to eliminate preventable harm. We call it our Zero Hero program. And zero is the goal, no harm in our hospital. And hero is a heroic effort to get there. And it starts with getting our staff to be inspired around the fact that we can do better. And that starts with outlining what it is that we have to improve and how do we implement change to get to that improvement. So an important piece of this is engaging the families as we go on rounds every day. And that's a journey. Some people feel like you just say, okay, every day we're going to include families in the conversation around what's needed for families. But it creates a sense sometimes that people feel it's an inefficiency on rounds. It disrupts our rounds. Yet in actuality, what we want is to have the sense of communication and team around the family rounds. And so we've been able to go from physicians rounding by themselves in the conference room to physicians and nurses and the whole team and the family at the bedside talking about the plan for the day. And that makes a huge difference in terms of outcomes for families and making sure that we understand not only the family's concerns, but the family understands our concerns for their child. We have focused on, in healthcare, a preoccupation with failure. When something doesn't go right, we dive in, we examine it, we figure it out, and we do a root cause analysis. I think the next steps are preoccupation with success. What are the things that go well, and reproduce those and spread those as opposed to focusing on what are the things that don't go well. I think that's the next steps for us.